Depression is one of the most common mental health illnesses, and it can arise in response to many factors, including loss of a loved one, a difficult relationship, substance use, and many other stressors. And there is a genetic component as well. However, some people may not be able to identify the source of their depression. Depression can affect your mood, your thoughts, and your behaviors, and your day-to-day functioning. Depression is a serious mental illness that can worsen, and when it worsens, it often includes thoughts of suicide or wanting to harm oneself. Depression is different from a case of the blues or sadness, which is a common reaction to a stressful event, but it usually passes quickly. Depression may linger for years or indefinitely, and people often need assistance to get better. I mentioned it is a common mental health illness, and some 17 million Americans will likely experience a depressive episode sometime during the year. If you're experiencing some or all of the symptoms I'm about to list for more than a few days a week or most days a week for at least 2 weeks, you may be experiencing a depressive episode. Screening is important because some people do not recognize the signs or symptoms of depression, and they may attribute them to a different illness. Some people may think depression is a normal part of life or that they have the blues. Others may feel that they will be judged or labeled as weak if they share what they're experiencing. So what are the symptoms? The symptoms include sadness, in some people, weepiness, in children and adolescents, irritability. You may experience feelings of guilt or worthlessness. You may be tired, fatigued, or low in energy. Some people experience insomnia, while others may sleep too much. Your appetite may vary. Some people have an increased appetite and others a reduced appetite or are not interested in eating. You may have trouble concentrating or finishing tasks or paying attention to detail. And in more severe cases, you may experience thoughts of suicide or of harming yourself. Now, regardless of any of the symptoms that I've listed, if you are experiencing thoughts about suicide or ending your life, planning ways to end your life, please seek help immediately. You can call 911. You can call the National Suicide Prevention Hotline, or you can go to your nearest emergency department. Now, if you do get screened and you're diagnosed with a depressive disorder, you and your provider can decide the best course of treatment for you. Treatment often includes medication and or talk therapy, and oftentimes both. Medication can help reduce some of your symptoms, and talk therapy can help you understand your depression and thoughts and behaviors that go along with that, and help you develop skills to cope and manage your symptoms. Now, I just wanted to reiterate that depression is an illness. It is not a sign of weakness or a lapse in character. Depression is treatable. You can get screened in the privacy of a healthcare appointment. And most importantly, people living with depression can live full, robust, and meaningful lives. Thank you.